working on end of year reporting, working on severe weather response. There have been floods all over. So there is a lot that everyone in this space has been navigating. Um, One, just thank you. I know it has been chaotic and felt a little bit kind of like whiplash with all the start and stop. So we will provide just as much information and clarity as we can while we get it. Um, I don't foresee any kind of restart of an application process until at least the week of the 29th. I think given that we won't have the written orders related to the preliminary injunction until early next week, nor will I think I got muted. Pardon me. What HUD may be publishing today, that'll take us a little bit of time to also review. So I feel fairly confident to say that there shouldn't be too much change that we see for our local process next week. Um, Whether that can give you a little, sigh of relief or a weight off your shoulders, um, take it as we may. Um, we are going to be recording this session, as I said earlier, so um, just please be aware. If anyone has any problems, you are welcome to leave and review the recording, but I'm going to get that started before I get my slides going. Oh, it did start. Never mind. Somebody's already on it. Probably you, Catherine.
No, no, it was Joe.
Oh, see, it takes a team, y'all. So I will get my slides started. Also, good morning. I am Kelsey Beckmeyer, she, her pronouns. I am the CoC manager with KCRHA and will be guiding you through some of these deep dives. So just want to start that these are really intended for those who are thinking of applying for funding with the NOFO. This is focused on transitional housing rules, regulations, requirements based upon the CoC program. So that is what we will be walking through today related to transitional housing. We'll talk a bit about what transitional housing is, what some of those requirements are, a bit around kind of core CoC and program requirements writ large, eligible activities and cost structures for a transitional housing program, match documentation and policy requirements, participation in HMIS and coordinated entry, and then we'll discuss some of the reporting requirements, performance expectations, and monitoring. I do want to note we also have a session this afternoon that is on more detail regarding federal regulations, federal cost principles, audits, monitoring, that goes into a little more detail than we will go into this morning. That will also be recorded and posted online. So first, I want to talk about what transitional housing is. This is temporary housing, crisis housing, really, for folks who've been experiencing homelessness. It pairs both that kind of crisis housing with support services, with the goal of having some interim stability and support to support people into transitioning to permanent housing. It's important to note that those who are in transitional housing are considered sheltered homelessness. So while folks are in transitional housing, they meet the definition of literal homelessness. However, enrollment in transitional housing does pause someone's ability to meet chronic homelessness. So if you're in transitional housing for literal homelessness, meanings you meet that, but it's a little complicated when it comes to chronic homelessness. Transitional housing can provide that crisis housing and services for up to 24 months. There is a specific regulation in the 24 CFR 578. This is the CoC program interim rule, that participants may stay longer than 24 months if permanent housing is not yet available or more time is needed for independent living. A note that if more than 50% of participants in that program are staying more than 24 months, HUD may discontinue assistance. So as this is an exception, not a rule. So be careful around that 24-month requirement, and allowing folks to stay beyond. It needs to be clearly documented that a household needed an additional time to secure permanent housing. A couple of the general CoC requirements. This is for really all programs. There has to be an ongoing assessment of supportive service need. That needs to be at least an annual assessment of need. That must be documented for each household and each participant. Um, The interim rule wants to see that projects and organizations receiving CoC funding are providing for participation of folks with lived and living experience in organizational policy making. So whether that is having folks on boards, whether there is a participant advisory committee, they really want to see that organizations are working with and designing things with folks who have lived experience of homelessness. There's also an expectation that with HUD to follow rules on fair housing and equal access. Now, there are executive orders that have been put in place that are kind of counterintuitive to these, but fair housing and equal access are still standing. Um, Fair housing is a federal law, and equal access still exists. It has not been rescinded. It is something that HUD is not monitoring for, but it is still expected that folks follow equal access rules. Finally, all programs must clearly have policies discussing termination of assistance, and that there is clear due process for all participants if there is termination of assistance. Going back into more details regarding program design for transitional housing, some of the expectations around transitional housing programs include that this is a housing-focused model. So the services that are provided are really to support households to access rapidly permanent housing options. That may be through support services designed to enhance employment opportunities, to address mental health or substance use needs. But the main goal is for folks to obtain and maintain permanent housing. Programs may require participants to partake in supportive services that are not related to a disability as a condition of participation. This is noted in the CFR. Um, Overall, HUD wants to see that there's a lower length of stay in transitional housing programs. While folks can stay up to 24 months, they do want to see that programs are working to rapidly get people into other permanent housing options. See that a high rate of permanent housing exits. They also want there to be a progressive engagement approach so that services are really tailored to that individual. And if things need to increase or decrease, they do so really related to what that household needs. While these expectations are operational in how the program runs, HUD does monitor those things. So those are asked about if HUD is monitoring a transitional housing program. Some The requirements for a transitional housing program include that participants must sign a lease, a sublease, or an occupancy agreement. These must be a minimum of 1 month and renewable for up to 24 months. Um, the lease, sublease, or occupancy agreement really depends upon the model of how your program pays for transitional housing units, and we'll get to that in a little bit. This is something that is, if you are using leasing dollars, it is not required to impose an occupancy charge, but if you are going to charge an occupancy fee, it may not exceed higher than 30% of an adjusted income or 10% of a gross monthly income. So paying attention to the rules about what can be charged and how that can be charged. All units that are funded with CoC dollars must participate in coordinated entry and enter data into HMIS. So if you have a program that has 20 transitional housing units and you are using CoC funding for 10 of those 10 units need to be offered through coordinated entry for folks to be referred to. Also, we require that the program data, the inventory is all entered into HMIS. Eligibility for folks to access transitional housing uh, is literal homelessness. Folks need to be experiencing literal homelessness. There's no other eligibility criteria related to income or kind of related to disability. The only eligibility criteria is that someone is experiencing literal homelessness as defined by HUD. And just a note again that that time in transitional housing pauses someone's chronic homelessness status. So being aware of this, particularly as it pertains to potential referral to permanent supportive housing. A lot of permanent supportive housing requires chronic homelessness, and that can be a challenge with transitional housing and folks who may need permanent supportive housing in the long run. There also have to, again, be those housing agreements. So there needs to be a lease, a sublease, or an occupancy agreement that meet 3 criteria minimum. The initial term is at least 1 month. It automatically renews unless either party gives notice, and there is a maximum term of 24 months. Supportive services are required to be offered in a transitional housing program. Folks need to be able to provide or partner with another provider to offer services such as job training, employment improvement skills, life skills, childcare opportunities, other pieces that help participants to either obtain or maintain housing. Services need to be tailored to each participant's needs. So it's not a one size fits all, but really those support services should meet the need of that individual. Programs might offer up to 6 months of post-exit services to support someone who is transitioning into other permanent housing. So if somebody was staying in a transitional housing unit for 12 months, they may continue to have 6 additional months of support services. We also want to see programs supporting folks to connect to other mainstream or public resources, such as Medicaid, SSI, food assistance, other health insurance possibilities. So wanting to see that we're creating those partnerships to gain access to other means of support. A note on enrollment continuity. So if a participant leaves or needs to go to the hospital, is in jail or another institution, they can maintain their program enrollment if that absence is less than 180 days. If that absence is more than 180 days, you would need to have documentation and justification to maintain someone's enrollment. You can also continue to pay for the unit, whether that's through leasing costs or rental assistance, while someone is absent. The kind of another programmatic piece is that all transitional housing programs, really all CoC funded programs, need to have very clearly written termination procedures that include a written notice for the reasons of termination, the opportunity for someone to appeal or request a hearing with the agency, a right to present evidence and bring representation, and then have a written final decision. Termination from a program really needs to be the last resort. And if you are using rental assistance dollars, particularly, and someone is in a lease, if you are terminating somebody from a program, you also need to be in connection with that landlord around any potential eviction issues. This is really why it should be the last resort. You cannot just exit people. It has to be really clearly noted as to why, and seen that participants have the ability to appeal, and they need to be able to access shelter while they are appealing if possible. And that is something that the program needs to be able to help facilitate. You cannot immediately evict without due process unless safety is an issue. And just wanting to note that this is a major compliance risk area that is seen across a lot of programs, just writ large with CoC programs. So making sure you have a clear termination and due process procedure that is provided to all participants at enrollment. There are some habitability and property requirements for transitional housing programs and units. So we will walk through that next. The normal HUD standard is housing quality standards. For transitional housing, um, those projects can meet habitability standards. This is outlined in 24 CFR 578.75B. Well, you'll be able to get the hyperlink when we post the materials. So this applies to any transitional housing unit, whether it is leased or owned. Um, if you are using rental assistance to pay for transitional housing units, then you have to use housing quality standards. So housing quality standards must be the standard that is used if you are using rental assistance to pay for transitional housing units. And just a note that that's a pretty rare model for transitional housing. Typically, transitional housing projects will use leasing dollars to pay for those units, or the project owns those units, so they don't need additional funding. So keep that in mind as you're thinking about program budgets and program design around the habitability standard that you need to meet. Some of the key elements that we look at in terms of habitability include sanitary facilities, that there is food preparation and refuse disposal, space and security, heating and cooling is functioning, electricity, fire safety, and lead-based paint compliance. Lead-based paint compliance is another pretty common monitoring finding. This is required for all transitional housing that is serving children under 6 and or pregnant people. Um, so kind of no matter what, even if your unit was built after 1978, if you are serving children under 6 and or anyone who is pregnant, you need to do a lead-based paint review for that unit. This is a visual assessment at initial occupancy and annually. This is the other kind of important thing around habitability standards and housing quality standards. This has to happen on an annual basis. So it's both at move-in and then a year from there, particularly if folks are staying the 24 months. There have to be 2 inspections that have occurred in that time. Both the habitability standards, housing quality, and lead-based paint requirements. This is, again, a pretty common monitoring finding of not having the annual inspections completed. Before a program can receive CoC funds, the transitional housing site has to have an environmental review. This is required for new buildings, new sites, leasing of a building for transitional housing, and must be completed before signing any leases or before funds are obligated. This will happen in the post-award process with HUD. This is typically done by the local government or HUD, and we coordinate that typically with our local field office before they will send the grant agreement to be signed and executed. So if you are applying for a new project, we would connect with you around ensuring the environmental review is completed. Sometimes HUD will have that documentation and can carry that forward for a site. Other times we'll need to work with the local government to ensure it gets completed. Just again, a couple of key compliance notes. We need to make sure you are maintaining a reasonable cost per household as you develop budgets. Transitional housing needs to adhere to all housing quality inspection or habitability inspection requirements and lease requirements, and needing to ensure that services and housing activities are clearly documented, as well as monitoring length of stay for all participants to avoid exceeding more than 50% of participants staying more than 24 months. We're going to move over now to talk about eligible activities and costs as you look at budget development for transitional housing projects. The allowed eligible costs, so these are the major budget categories that a project may request from HUD for a transitional housing project. That is leasing, rental assistance, operating, supportive services, HMIS, and project administration. These are the different buckets where you can put the costs that you are hoping to pay for through a CoC grant. You do not have to ask for all of them, but these are the ones you are allowed to look at requesting and building your budget around. Leasing costs can cover agency payments for rent or of units or structures. They can cover security deposits for up to 2 months, as well as first and last month's rent on a unit. This can also cover the staff costs related to leasing activities, which include conducting habitability inspections, processing landlord payments. So there is the ability to pay for some staff and overhead in the leasing category. You may also pay for unoccupied units between participants. So if you are, for example, master leasing 5 units from a single apartment building and 1 unit someone moved out of, you can continue to pay the cost of maintaining that unit and holding that unit until you get another participant in the unit. Rental assistance is another eligible cost. So again, typically we see projects use leasing to pay for units versus rental assistance, because rental assistance can be done is done a little bit differently. So what can be covered includes first and last month's rent, security deposits, property damage up to 1 month, 1 time per participant. It can cover ongoing rental assistance for the unit that is being used for transitional housing. Those vacancy payments only up to 30 days, whereas leasing, it can cover unoccupied units between participants, whether that's beyond 30 days or not. And then staff and overhead costs, again, you can charge under rental assistance for those activities, such as intake processes, the housing quality inspections that are required for rental assistance, writing rent checks. A note that a project cannot pay short-term rental assistance when a participant is exiting the transitional housing. So it conferred with some HUD technical assistance around whether or not a project can get leasing dollars and rental assistance and use rental assistance to pay security deposit and first last month's rent as someone is exiting transitional housing, but that is not an allowed cost for a transitional housing project. A little bit around the difference between leasing and rental assistance. If you are using leasing to pay for transitional housing units, you may charge an occupancy fee, but it's not required. And then the lease is typically in the agency name, and you are subleasing or creating an occupancy agreement with participants staying in those units. Whereas if you are using rental assistance, participants must pay a portion of rent during their time in the transitional housing unit. The rental assistance may be tenant-based rental assistance where it follows the tenant, or sponsor or project-based where you use those rental assistance dollars for a specific unit and it doesn't follow the tenant. Programs really should opt for one method or the other. Again, the most typical is to use leasing dollars if you are needing to pay for units. That is what is most commonly seen with transitional housing programs. For operating costs, these are the costs associated with the day-to-day physical operation of housing where the participants are staying and living. Grant funds can also cover staff and overhead costs directly related to carrying out these various activities, including maintenance and repair, building security, covering electricity, gas, and water, paying for furniture to furnish units, as well as other equipment that may be needed. If you have a front desk and security, you may need a computer at the front desk station. Those things may be covered and under operating costs. For supportive services, these services must be focused for program participants to obtain and maintain housing, and grant funds can only be used for the services listed in the CoC program interim rule. They need to be direct provision of services. We can include the cost of labor, supplies, and materials for a project, and then salaries and benefits for staff delivering the services are also eligible. So the eligible services that are listed in the CoC program interim rule include assessing service needs, moving costs. This is costs to move someone into a unit with getting a rental truck, paying for boxes, those kinds of moving costs. Case management services, childcare, education services, employment assistance and job training, food. A note that food used to be an operating cost, but is no longer eligible as an operating cost. That needs to be billed and done under support services. Housing search and counseling services, legal services, life skills training, mental health services, outpatient services, outreach, substance use treatment services, transportation, and utility deposits. These are all eligible costs under support services. We link at the end a list of what are called virtual binders, and these are at-a-glance summaries of each of the eligible cost areas, so you can have a little more detail of what is allowed as you develop a budget. Project administration is also allowed. These are general management and oversight and coordination costs, training on CoC requirements, reporting and costs to kind of cover staff that are working on those pieces. Up to 10% of the grant can be requested for project administration. You have to look at the direct line items, so your support services, your leasing, your rental assistance, your operating, those are your direct costs. 10% of those is what can go towards project administration. A note that KCRHA holds 5% to cover our administrative responsibilities for CoC grants. So please keep that into consideration. We also have in the budget template that we have prepared for folks creating new projects, created a formula that will cap what the project admin will be. So it automatically calculates that. A quick note that any costs that include staff or overhead that are directly related to carrying out eligible activities under leasing, under rental assistance, or support services should be charged to those budget line items. So any of that staffing or indirect costs can be charged to the support services line item versus project administration. Project administration really needs to be focused on general management, oversight, and coordination, training, and reporting work. There are some cost restrictions, and also want to walk through some of the match requirements for CoC funds. Before we get there, I do want to pause to see if there's any questions around eligible costs.
Kelsey, there are quite a few questions in the chat.
All right, let's, Catherine and Joe, if you would start compiling those questions, and then at the end we can kind of walk through all of them, unless there are specific ones around cost eligibility right now. And will keep us moving.
Go ahead.
All right, awesome. Thank you. All right, so some restrictions and prohibitions. Grants may not fund rental assistance and operating in the same unit. So if you are using rental assistance dollars to pay for a unit, you cannot use operating on that same one. So if you're paying rental assistance, you can't pay for maintenance on that unit. You need to be sure around how you are using these costs, with rent, particularly rules around rental assistance. Grant funds cannot fund emergency shelter or supportive service only facilities. It has to be for the unit for transitional housing. Maintenance and repair costs that are included in your lease cannot be covered with grant funds. So those, if the property management company is stating that they cover these things, you should not also be paying for those things with grant funds. You cannot combine in a single unit or structure rental assistance and leasing dollars or rental assistance and operating dollars. So this is part of why many programs use leasing dollars, because if you're using leasing dollars, you can also use operating dollars to help maintain units. Programs may not charge participant fees. Those can be fees like an application fee, a participation fee. If there are fees that are not commonly noted in a lease, that everyone is paying, they cannot be charged to a participant, and you cannot use grant funds for those fees. So again, we touched a little bit on rent and occupancy charges. Participants who are using or receiving rental assistance must pay a portion of rent. And we've outlined the two areas where you can see more on how to calculate rent. You have to look at income and look at the rent calculation. Again, that 30% of their adjusted income or 10% of gross, whichever is less. Occupancy charges and rent charges must be reasonable. and those are outlined by 2 CFR 200-404. Another important thing is that leasing costs are exempt from match requirements. So if you have a $500,000 grant and $200,000 of that is leasing costs, your 25% match is only based on that $300,000, not the full $500,000. This will be accounted for when you receive notification, typically from KCRHA, around what your match requirement is. Lease costs will be exempt from that. If you are getting rent or occupancy charges, those are considered program income, and those may be reserved to help participants move to permanent housing. This is usually with leasing dollars. So if somebody is paying an occupancy fee, that can be reserved in your program income to help pay some costs for folks moving into other housing. That does need to be tracked internally and have records on that. CoC match requirements. This is something we are often asked about. CoC projects writ large require a 25% match from non-CoC funds. They may be other federal dollars. So for example, if you have CDBG funds, or you got funds from the Department of Justice for VAWA or DV funds, those may be considered toward match dollars. Match is either cash or in kind. Match can only be applied to CoC eligible program costs. So if a cost is not eligible under the CoC program, it cannot count as match. One thing that often comes up with match is you paying off rental arrears. Rental arrears is not an eligible CoC cost. So any cost to pay down that debt or rental arrears would not be considered match. It has to be a CoC eligible program cost. Your match does not need to align with how your HUD budget is detailed. So if you have all of your CoC award is in supportive services, you can say your match is from operating costs, but they have to be CoC eligible operating costs. A requirement for all programs is to have written policies and procedures that describe how you identify match, apply it, and track it. So that will be a required policy that will be monitored both by KCRHA as well as by HUD. Next, we will talk about some of the HUD rules regarding HMIS and coordinated entry participation. And just want to note that current standing federal regulations apply in spite of current executive orders that may be in existence. So first is the equal access rule. This is written into the HUD CFR. So all transitional housing programs must comply with the equal access rule. That is that there is access to all folks, regardless of sexual orientation, gender identity, or marital status. That participants need to be placed in a unit or a program according to their gender identity, not sex assigned at birth. This applies to both congregate and shared transitional housing settings. Programs need to have policies and staff training on the equal access rule. A note that KCRHA does have a training linked on our website around the equal access rule. All traditional housing programs that are receiving CoC dollars must participate in both HMIS and coordinated entry. You need to enter data into HMIS within the timeliness standards, collect all universal data elements and program-specific elements. There are caveats regarding domestic violence participants that are de-identified. And all programs must participate in coordinated entry. And there is, again, a separate system for DV programs. So you would have to accept referrals from coordinated entry, follow the prioritization rules that are set with our coordinated entry system, and have documentation of coordinated entry compliance. Both HMIS and CE compliance can be frequent monitoring issues. So we want to provide you with some upfront information, as well as where to get some more detail. So first about participation in HMIS. So all CoC funded projects must participate in HMIS unless somehow prohibited. For our program serving folks fleeing domestic violence primarily, there is a separate system that is a mirror of HMIS. Participation supports federal reporting, system planning, and performance measurement. So this is a requirement. Some of the required data includes following both HUD, state, and local HMIS data standards. Those are all posted on the BitFocus website. BitFocus is the vendor who operates the software for our HMIS system. Universal elements are required for all participants. There are caveats to those who may be de-identified. And then program-specific data elements are based on the project type, whether it's permanent housing, transitional housing, rapid rehousing, etc. There may be different program-specific data elements that are built in when your project is set up in HMIS. Data needs to be entered within required timeframes. These are noted in our HMIS policies that we are linking to later on in the slides. But there are expectations around completeness, accuracy, and consistency. So we have particular measures around data not collected, data unknown, and thresholds that we want programs to not exceed when it comes to data incompleteness. There are also privacy, security, and confidentiality rules and standards that must be followed. All HMIS users must also take an annual privacy and security training and adhere to secure user access, privacy notices, and proper record handling. This is monitored by KCRHA on a regular basis, and users who are not complying will have their access revoked. HMIS is an eligible cost category, and this is the cost to enter data into HMIS. So if you have a staff person who is entering all the data, that can be an eligible cost if you request HMIS costs in your grant. Those costs must be reasonable, documented, and clearly tied to program operations. Some effective HMIS policies include, again, timely data. You will hear timely data entry a lot when it comes to HMIS. This includes project entries, participant updates, and exits that are required within certain timeframes. Complete and accurate records, so having consistency across enrollments, updates, exits, and inventory records for all participants and all units. Participation in coordinated entry, so completing assessments, referrals, and outcomes to be entered in HMIS. There is also privacy and security compliance. And then responsive during federal reporting season. There are a number of different federal reports that are required to be submitted on particular timelines. These can vary, and you will get a lot of notice from both BitFocus and KCRHA when there are requests to review data, clean up data, or submit data. These are reports related to annual performance reports, the point in time count, housing inventory count, system performance measures, the longitudinal system analysis, and our CoC NOFO submission. Some of the pitfalls that we see in using HMIS include delayed data entry. So either forgetting to do entries or exits or doing so long after a participant has departed, you will not get accurate information if you are entering data a month after someone has left a program. Missing or inconsistent data, overuse of data not collected is really looked at and flagged. And then inconsistent data collection practices. So you don't have a streamlined way of collecting data from participants, whether that's intake forms, annual assessments. Not having those things can really lead to that missing or inconsistent data. Privacy and security risks are another big thing. Sharing logins, having outdated access. So if staff have left and you haven't updated their access, storing HMIS data outside of approved systems, downloading data, emailing data, all of these things are security and privacy risks. All of this leads to reporting impacts. So poor HMIS data impacts your annual performance report accuracy. How your program is performing can be impacted. How the larger system in King County is performing may be impacted. Your score for the NOFO process may be impacted, that is very heavily reliant on HMIS data. And HUD monitoring outcomes will also be impacted. So being very careful and diligent in how you are gathering and entering HMIS data is prudent. A couple of confidentiality requirements under 24 CFR 578.103, VAWA, and HMIS rules, there can be no public posting of identifiable information. There needs to be secure storage of both paper and electronic records. You need to have written confidentiality protocols, and there needs to be an emergency transfer plan that's required under VAWA, even if your project is not DV focused. For coordinated entry, all projects must publish written standards for household eligibility and screening. We want to know kind of what your standards are. We want to align that with our coordinated entry system as also. You need to communicate project vacancies, including bed and unit specific information to the coordinating entity, that is KCRHA. Enroll only those households who are referred according to the CoC's designated referral process. So you should not be referring or enrolling people in your program that was not referred through our coordinated entry system. And then commit to participating in the coordinated entity's planning and management activities as established by CoC leadership. So we want your input. We want you to be involved in our coordinated entry system, its design, its practices. We have a number of ways for folks to do that, whether it's through the coordinated entry committee, whether it's through the single adult leadership team, the young adult leadership team. There are a number of different ways that we are trying to get input and coordination with folks as we do kind of continuous improvement with our coordinated entry system. All right, program policies and documentation. We're going to try and get through all this, then we'll have ample time for questions. So there are requirements both at the agency level and at the program level. So just a quick overview of required policies. So CoC projects need to have policies and procedures for project intake and eligibility, how you are determining and documenting eligibility, HMIS, project requirements, a termination policy, participant file record keeping. Some of those records that are required include eligibility, so literal homelessness documentation, an occupancy agreement releases, HQS inspection or housing or habitability inspections, rent calculation and income documentation, lead safe paint, provided services, assessment of services, and proof of due process if terminated. You also need to have required policies on eligible costs and maintaining supporting documentation. So how are you determining costs are eligible and ensuring that you are documenting that? Then a policy on CoC match tracking, how you are accounting for match, tracking match, and ensuring they are eligible CoC costs. When you are creating policies and procedures, it's very helpful to ensure that you have consistency and fairness within those policies for all participants, that you are meeting the regulatory requirements outlined in 2 CFR 200 as well as 24 CFR 578. And there are two lanes of policy and procedure. There's overall organization operations, and there's program operation, including participant documentation and record keeping. So ensuring that those two lanes are being accounted for when you are developing policies and procedures. The program documentation requirements, again, for transitional housing includes homelessness status documentation, disability status, if applicable, typically not with transitional housing, but there may be other fund sources that you have that do require disability status. Income and rent or occupancy fee calculation documentation, termination of assistance notice, and any end due process if that is done, case plans and services provided, habitability or housing quality inspections, and then the lead-based paint evaluation. Record keeping, again, check the requirements. That is in 24 CFR 578.102, ensuring that you are maintaining records and having acceptable evidence of, most importantly, homelessness status. But this area of the CFR also covers emergency transfers, income documentation, housing standards, service assessments, match, confidentiality, and record retention. So I just want to highlight this as an area that would be very important to review and be familiar with. We are nearing the end of this one. So I want to talk about performance and then reporting requirements. So there are performance expectations for transitional housing programs that both HUD and KCRHA will monitor for. Those include the length of stay with the target below 24 months, the rate of exit to permanent housing for participants in transitional housing, the return to homelessness rate that is looked at from a 6 through 24-month window. So are those who are exiting permanent housing returning to homelessness? We track and review that. Your utilization rate, so the occupancy rate of the beds or units. And then we also monitor for service engagement and case plan documentation. We want to see and note that your services are being tracked through case notes and documentation. The monitoring and performance expectations all influence the CoC ranking and renewal scoring that we have to do through the NOFO each year, maybe one day biannually. The big reporting mechanism that we do with CoC projects is the annual performance report. This is due to HUD at the close of each performance period. So this tracks program outcomes, effectiveness, and compliance for all CoC-funded projects, and it demonstrates progress towards goals and helps to inform funding decisions, both at the local level and with HUD. Key components include program outcomes, so they look at housing stability, exits to permanent housing, length of stay, income and employment changes, and returns to homelessness. They ask about services provided, including case management, support services, skill development, healthcare access, and then the housing inventory, so the number of units available, the utilization rate, and the vacancy rates of units. These are required annually, and they are based on HUD CoC performance measures. Data quality is also reviewed to ensure that we have accurate and verifiable records. before submitting a annual performance report or an APR, KCRHA will review those and highlight areas where data quality looks low, so that you all can do a review to ensure that data quality is accurate. APRs are used for program monitoring to identify strengths and improvement areas for programs. They help guide funding decisions around what projects to be renewed or potentially reallocated, and then also support our system planning to see what are our strong performing projects, what are ones that need more support, or what are projects that are really aiding in our community-wide goals to end and reduce homelessness. Finally, I want to talk a little bit about some common compliance pitfalls that we see when it comes to transitional housing. Lengths of stay exceeding 24 months, especially if it's more than 50% of participants, that's a big red flag. Missing or incomplete termination and due process documentation. If we see that folks were terminated or exited from a project early and there's no documentation about why, that is an issue. Improper use or tracking of program income, charging prohibited program or participant fees, habitability standards that are not met or not documented, again, on an annual basis. The same goes for the lead-based paint assessments that either can be missing, outdated, or not done on an annual basis. Combining rental assistance with leasing or operating in the same unit. Insufficient documentation of support services and assessments. So not seeing any case notes, not seeing any annual assessment plans. Those are all issues. And then not complying with HMIS, equal access, or confidentiality policies. Again, we've listed some additional resources for you all to access. We'll get these posted online and you can access all of the hyperlinks. This is talking about CoC leasing and rental assistance requirements, at a glance around eligible costs for leasing, operating, rental assistance support services, eligible activities overview. We've linked to our BitFocus website, the Clarity General Training if you do not currently have access to HMIS, as well as the HMIS Privacy and Security Training, the HMIS Program Setup or Change Request Form. So if your program is funded by HUD and you need to create a new program, you would do the request there. Our coordinated entry trainings that are provided, both to access coordinated entry as well as to be an assessor, and then our CE assessor manual. All of those will be posted within probably by Monday or Tuesday. All right, I'm going to stop and we will use the last about 20 minutes we have for any questions that you may all have. I'm going to quickly stop sharing my screen just so I can see you all a bit. And if I need to pull the slides up again, I will. All right, I'm going to go through the chat really quickly to look at questions and just provide some responses. We also have folks taking notes, so we'll post a Q&A along with the recording and the slides. So yes, you will receive a recording. Is at 50% capped at the program or CoC level. This is at the program level. So a single transitional housing program cannot have more than 50% of participants who've stayed more than 24 months. Again, that is still a red flag. You have to have really clear reasoning as to why a single participant stayed more than 24 months. Okay, that was answered. For participation, do you mean households are required to consent to HMIS or forego? For the participation in HMIS, you all as providers must enter everyone into HMIS. Someone can choose to be de-identified, but you still need to be entering that information, including enrollment, exit, assessment. Even if they do a do not consent, that means their identity won't be in, but the services you're providing need to be in there. So if you're serving 20 people, there should be 20 people entered in HMIS. There might be 5 who are de-identified because they did not consent, were fleeing DV, or other privacy reasons that are outlined in the HMIS consent form. I am going to, we will put a written response around the difference between literal and chronic homelessness. It's not that pertinent to the operating of transitional housing, but we will put a response on there. Is rent paid to the program considered program income still? Yes. If there is rent being paid to the project, to the program, so you're leasing and someone's paying the program an occupancy fee, that's considered program income. If you're using rental assistance dollars and you're paying a landlord and the participant is paying their rent portion to the landlord, that's not going to the program and that's not program income. This is around really occupancy fees, or if there's a rent fee going to you as the agency, that is considered program income. For literal homelessness, this is both category 1 and 4. So this is literal homelessness and those who are fleeing or attempting to flee, DV, etc. Local competition question around the NOFO. Well, I have no answers right now. We do not anticipate, we don't know. Yeah, so I cannot give you any solid answers about what the future may look like with the NOFO. Seeing some good ideas around exit meetings. That may be something to note. Our emergency services and housing stability teams hold typically monthly base building spaces. So all rapid rehousing providers, all transitional housing providers, to do some kind of collective learning. So Mike would flag that for that team as a good idea to bring folks together. Uh, is cooling required? I would look at the habitability inspections, knowing that we are in the Pacific Northwest, where not everywhere does have cooling. If it is, it needs to be functioning. We don't know how many new projects we may be getting, so environmental reviews is again an unknown. And we won't know what's funded, so it's kind of, that one's a hard one to do some pre-planning around. Would encourage all of you, though, as you are planning projects, to connect with your local governments around environmental reviews. There's a question on, at the end of a participant's time in the program, will they be able to stay in the unit and take over the lease? That depends upon the model that you are using for supporting the units. If you're using rental assistance and paying rental assistance to a landlord, and the participant is also paying a portion of rental assistance, and the 24 months ends, they may be able to stay in that unit. If you're using leasing, it's a little different. Leasing is usually connected to that unit and stays with the program. So folks typically wouldn't be able to transition in place in a leasing model. There are policies. There's a question on, let me read these out a little bit so you have context on what I'm saying. Question on policies and guidelines on calculating household income. Yes, there's quite a bit of guidance that HUD has that's linked in the slides. They have a list of things that are considered assistance, and those are fairly detailed. For calculating household income as it pertains to determining a rent portion share. Any program income that comes in should be spent on eligible costs, because program income can impact match and everything. There's a question on the 40 hours a week. Unknown. HUD rescinded the NOFO that had the 40 hours a week of support services. That was one of the provisions noted in some of the lawsuits. When HUD rescinded, they said they were going to be evaluating what was noted in the various lawsuits. But it is really unknown at this time what it is. A question around if applicants need to seek out match. At this moment in time, yes, you need to be able to identify that you will have match or be able to get match. Um, the 5% admin fee covers the work that we all do, monitoring, doing technical assistance, processing payments, invoices, program reports. So it covers the various work of different teams and departments through KCRHA on particular grants. Not all the time is it the full 10%, but we have to do a minimum of a 50-50 split with the project admin per the HUD CFR. All right, we own our transitional housing units. When our participants are exiting transitional housing and moving out of those units into their own rental housing, is the money they will need for security deposit and first one's rent an eligible cost? No, it is not. I checked in with HUD TA around this, and they confirmed for me that no, programs cannot pay those security deposit and first month's rent with CoC funds. If you have other funding, you can use the other funding for that. It cannot count towards match. Is this equal access rule applicable to the Section 504 standards? These are separate. So equal access rule is around gender identity and ensuring folks are provided equal access to shelter, housing, etc., based upon their gender identity. Section 504 talks about disability rights and ADA access. So those are two separate things. A question if you're allowed to take referrals outside of coordinated entry. No. We got a notice from HUD, I want to say back in 2022, around what was being called external fills, and those are no longer allowed per guidance from HUD. HMIS costs is, yes. So HMIS costs, if you are entering data, putting things into HMIS, doing data entry into HMIS, that can be captured under the HMIS cost category. So there are allowed costs. You can charge that under project administration if you don't have HMIS as an eligible category. We locally don't have any projects that have an HMIS budget category, so that's largely captured in indirect costs or project administration. Can an org request funding and participate in coordinated entry and HMIS for part of our program, but not all of our program? Yes. If you have, again, a project that is 20 units and you are seeking CoC funding for 10 units, those 10 units are what are required then to be in coordinated entry and HMIS. You do not have to do the full program if those units don't have other public funding that stipulate participation in HMIS and coordinated entry. We would love to see projects reporting in HMIS. It just makes our understanding of our system stronger. But if you have funds that don't mandate that or require that, you don't have to participate in HMIS. Will these funds be able to pay for software for tracking? That would want to know more about that if that's outside of HMIS. If you can pay for your internal processes, that may be captured under your project admin costs, or the overhead related to support services. So if you're tracking case management and you have a software system that's doing that, you may charge that towards those overhead costs with supportive services. If we have a template for providers to use view, we can put together some checklists for folks around policy requirements and what is needed. There are some templates we have on certain ones. I believe we have one on due process, termination and due process. I think that one's focused on rapid rehousing, but we could make an update. So if folks have particular requests on policies or templates, if you would send that to our coc.questions email address, that would be extremely helpful. I'm putting that down in the chat, and now I have to scroll back up to find where I was. Oh, here we go. Not too far away. Your org is faith-based and primarily privately funded. Is it possible to get funding for non-faith-oriented activities that are otherwise allowable? Yes. Yes, there is nothing prohibiting a faith-based organization from applying for CoC funds and using those funds for certain activities. There may be, it depends on what those activities are. They have to be eligible CoC activities. So it can't just be anything that you are thinking of, but it has to pertain to those eligible CoC activities. A note on the exits to permanent housing and those performance measures. Those are really set by HUD. And while we can make changes to local level, we still have to adhere to what HUD is wanting to see, and we are still monitored in that regard with our system performance measures, particularly. We know it's not easy. There are sometimes expectations put on systems that systems cannot meet because we cannot make changes alone. And we rely on other systems to also make changes. Okay, I've said that over 24 months is not allowed for transitional. So transitional housing, it is up to 24 months. That is what is allowed. That is the maximum allowed. There is a caveat. If a participant is unable to find permanent housing or needs additional supports to maintain housing or access housing, then if it is properly documented, they may exceed 24 months. But that all needs to be very clearly noted and delineated as to why their enrollment is beyond 24 months. So keep 24 months in mind as the cannot exceed 24 months. If food is a supportive service, just serve 3 meals a day and track attendance, and there's your 40 hours a week right there. Could be. There are some caveats on food. It can be groceries and food service. So it can also be providing groceries to tenants. So if folks are living in a scattered model, you can provide some grocery support to tenants. The minimum time is a month. So for a lease or an occupancy agreement, the minimum amount of time on that lease or occupancy agreement is 1 month, and it has to be automatically renewable. Are mold addendums required? That I would follow local jurisdiction rules around leasing and rental requirements. It's not noted in by HUD in the CFRs. I would imagine that is included in the habitability requirements and looking at mold. But I would be sure, especially where we are in the Pacific Northwest, there may be some Washington State, King County, city rules around mold addendums. Um, Again, questions on NOFO things and process. I don't have answers at this moment in time. The caveat around 24 months, yes, would likely need to be a hardship for pieces. Programs must offer up to 24 months. You There is nothing that states it cannot be a 12-month program. However, there has to be the ability to offer up to 24 months. That is all the chat questions. um, are there any other questions that are on folks' minds regarding transitional housing? Yes, Hannah.
For those income guidelines or policies at the HUD level, does that, so I'm curious how they incorporate like local state fund, like state cash programs and other more local income sources.
Yep, so usually, and give me 2 moments as I pull up um, an example doc in front of me. That is usually captured under non-cash benefits or cash benefits. So things such as ABD would be included. HEN is not a cash benefit, so that's not included as an income source. But again, I am pulling up my the best place where I have this. These will be posted on likely both the funding opportunities page and the CoC page where we've got the deep dives linked. We will put underneath them all the materials to the recordings. Okay, I am pulling up a doc I've got on income. So there is one that's periodic payments for Social Security, pensions, disability, death benefits, lumps payments such as unemployment, disability, workers' comp. So those are areas where the like ABD would be captured. And there's also welfare assistance as a line option. These are programs that are funded federal, state, or local governments. And there's links to the CFRs that are there. Okay, a question. If moving costs are not allowed when a client exits, you mentioned the program fees can be tracked and then used as moving funds. Yes, so this is a bit of a nuance. So if you are charging an occupancy fee, where folks have an occupancy agreement or a sublease, and the occupancy fee is going to you all, you are needing to track that project income. That is not considered the CoC funds, but that program income may be held, and that program income from that household could be used to support someone when they're moving out. Um, that is kind of how you would be able to do some of that. We can work with our HUD TA as well to put together some more guidance on that. It may be a moment in time to get that put together. But would love, Joe, if you are taking notes, if you would note that for me so I don't forget. Thank you very much. I very much appreciate it. Any other questions? Holly, yes.
I've been trying to find the exact reference to this, but have not been successful. And but I remember there being something that said in providing our match documentation, there were some really stringent things in there about like having this letter from the source of the matched documentation, and it had to have been signed within this very narrow time period. And I just would love to hear some advice on how to navigate that, because it even sounded like if you had unrestricted funding that you wanted to use as a match, you couldn't. Like it had to have been specifically granted for this purpose and contingent on the federal funding. And so that was something I was hung up on, trying to figure out how to navigate that piece.
Got it. So we have a match template letter that we can send and share with folks and get posted online. So if you have unrestricted funds in your organization, it needs to be noted that X amount of those dollars are for this program for CoC eligible costs. We also know, especially in the application process, a lot of you might not have fully secured match at this moment in time, because this might be a hypothetical project that you're putting forth, and kind of depending to see if it gets funded with CoC dollars. So the final match letters won't be required until we do grant agreements. So for the application, we are wanting to see that, like, these are the intended match costs that we would be doing. So really, for the application process, it's not so much about the sources that you have, but how you would apply match. So would you apply match to staffing costs? So or are you going to apply match to have operating costs, so maintenance costs? That's really what we want to see in the application stage of things, because we know that this might not be a program that starts operating until a year from now. And some other fund sources might not want to be dedicating funds or offering match until that point in time. Does that help, Holly?
It does. I'm also thinking about programs that we have that had a match waiver that it now may be going away. And so that kind of uncertainty on whether we're going to need it or not.
Yep. So for the good of the group, this is for our Youth Homelessness Demonstration Program projects, YHDP. Those projects are allowed to apply for a match waiver. That can be applied for again. And it would be determined when HUD makes award announcements if that match waiver is accepted in the next grant year. Keith, yes.
Hi. Yeah, with the YHDP thing specifically that you mentioned, the waiver would still only pertain if they went through the transition process to become an SSO grant, but not if they went to transitional housing, correct? Because I believe on the I can't remember the R word that they use for this instead of transition, for their for the
Replacement.
replacement, yes. It gives two options in replacement. It gives transitional housing or SSO only. So am I correct in understanding that the waiver would only apply if they were to stay in SSO?
I cannot confidently answer that question because the special activities are typically detailed further in the detailed instructions, and we do not have those from HUD, so I cannot tell you what the rules will be.
Wonderful, thanks.
It is fun navigating the unknown. Any other questions? I'll say I'm proud of the timing of this. Guessed about 90 minutes correctly. Well, if anything comes to mind, please email at the coc.questions@kcrha. We also will have another deep dive later today on further federal requirements related to financial monitoring, similar HMIS and coordinated entry things. So it may have a little bit of redundancy from some of the information this morning, but encourage folks to attend that as well if you have more questions on financial management and kind of policies and other pieces. That's also slated for an hour and a half. Wonderful. Well, thank you all so very much. Have a wonderful end of the year. I hope it is not overly chaotic for folks.
Thanks, Kelsey. Thank you.
Thank you all.
Thank you, Kelsey.
If you are still on the call, if you would please depart, that will allow us to get the recording ended so we can get it posted online.